Hey guys, it's Miranda. So I had the first 5 vocabulary words, so I'm going to kind of try to present these to you in a way that makes sense, hopefully. So here goes. So the first one I had was conceptualize family problems systematically. So basically in here, a counselor has to kind of recognize that the family is a functioning unit as a whole and not just an individual person. They look at their personal relationships, family history, their shared experiences, anything that they kind of do together. And like I said before, you're looking at the family as a whole system, not just the individual. The individual is not the focus of the treatment, it's everyone, and you're treating them all fairly and as together and as one. The counselor also has to understand the concepts and languages that are unique to this family in order to help conceptualize the family problems. So the second one on the list is locus of pathology for traditional theories versus the systems theories, but I'm just going to explain locus of pathology first since it's third, that way I can just kind of go right in. So locus of pathology in simple terms is just the location of the problem where it occurs. So in locus of pathology for traditional theories, this is where they would typically believe that the problem occurs within the individual and in their own mind, brain, and that they are having these problems because the individual has not resolved whatever conflict problem that they're having. So they would go to treatment and they think that, all right, we're just going to tackle this person one on one and try to figure out what's going on. Whereas locus of pathology for systems theories believes that the client who is having problems, it's not because of them. You're looking at the family unit as a whole. And it's usually the problems are a result of problematic interactions between the family members and usually significant ones that are in the family. Um, and like I said, it's not on the individual. Every member in the family plays a role in the creation and the maintenance of the problems. So you're looking at each person for helping the family, not just the individual. And the next one I had was identified patient. So the identified patient is someone who is presenting the problems that they have, the symptoms for the dysfunctional family. So if an individual is presenting problems, the traditional theory would say, all right, it's just them. But if the identified patient, usually typically the child in the family, if it was for the systems theories, they would say, okay, well, maybe this child is presenting these problem behaviors because something is going on with the family. So maybe the child has been acting up, and then they bring the whole family in and realize that, all right, mom and dad have been having some issues. And so maybe this is the child trying to reach out for help, and that's why they're having these problem behaviors. But you're not looking at just the individual as to why they're having these problems. It's the whole family. You're looking at each person in that unit and seeing why these problems are occurring. And my last one I kind of thought was funny. So, pseudomutuality. So for me, I kind of thought of like that perfect family that everyone loves to hate. So you've got fit mom and dad. They've got everything going on. They've got great jobs. They've everyone in the family. They have great style. They're all very popular. They're top of their sports. They've got great grades. And then you find out some dirt, and you're like, oh well. Susie, the daughter's, she's addicted to pain medicine or something, and son's actually failing, and mom and dad have been they're going through a divorce, and then you're like, well, maybe they're not as perfect as they seem. So this is basically pseudo-mutuality. So you've got that family that appears perfect on the outside, but on the inside they do not have it going on, and they're not all together. And that's basically what pseudo-mutuality means. And these types of families can put on a show basically and disguise their problems through these desirable traits that everyone loves and try to hide what's actually going on so that no one really knows. So that's kind of what I thought of that. I don't really know how to make other ones funny, but that's what I pictured for this one. So hopefully this was presented in an understandable way and you guys understood it. And I hope you have a good class tonight, and I will see you guys next week. Bye.